Hello everyone, good afternoon to all of you. This is Dr. Mansi Tyagi again with another session on another day of Homeo Talks 2025 webinar series from Homeopathy 360 in collaboration with Parul University. Today we have Dr. Hitarth Mehta, Principal Hospital Superintendent, Rajkot Homeopathic Medical College, Parul University, under tenure, institution received NABH accreditation and university received A++ NAAC grade under ranking of institution received A+ from QCI NABET. We are very proud to have Dr. Hitarth sir on the another day of this webinar series. And today we are going to learn about the title Efficacy of Ipecacuanha in cases of bronchial asthma. As you can see in the present times, we see so many cases of bronchial asthma, and we have many patients, and many people are suffering from bronchial asthma. Today we are going to learn so much information from Dr. Hitarth sir, and we are just waiting to gain some information, some his clinical insights on this topic. A very warm welcome to you, sir.
Good afternoon, madam. Good afternoon. Thank you. Just a minute. Just a minute.
All right, sir.
Please share my screen. Hello, madam. My screen is visible, madam.
Yes, sir. Your screen is fine.
So, good afternoon, one and all. And I'm very much thankful to the BJ publishers for the giving the opportunity, and it's a privilege for the Parul University. I will start with my webinar with the Honeyman oath. And Master Honeyman, on my honor, I swear that I shall practice the teachings of homeopathy, perform my duty, render justice to my patient, and help the sick to whosoever comes to me for the treatment. May the teachings of Master Honeyman inspire me, and may I have the strength of fulfillment of my mission. The main key features of my point, that is the efficacy of the Ipecac in cases of the bronchial asthma. Once we talk regarding the asthma, there are either patient is suffering from cardiac asthma or bronchial asthma. If any cardiac components patient is having presenting with, we can think of cardiac asthma. And my key features or key highlights of the research work, that is the number one, that is study to prove its outcome role of Ipecacuanha in cases of the bronchial asthma. And second is an examination of social acceptance of homeopathic medicine through the research study in the society. I have already started with my presentation with the bronchial asthma, and asthma is having the, it is nothing but bronchial asthma, which is characterized by, it's a paroxysm of the dyspnea, in which patient is coming with the breathlessness, and which is accompanied with the wheezing. And this results from three ways: by narrowing of the bronchial mucosa by bronchial constriction, by mucosal swelling, viscid secretion, and patient is presenting with breathlessness. So whenever we talk the any allergens or in response to the allergens, the mucus secretion gets increases in the mucosa, in the tracheobronchial tree. That will lead to the mucus gets plugged in the bronchi, and patient is suffering from the breathlessness or dyspnea. The main features of the homeopathic concept, that is the homeopathic approach, we have to prescribe the constitutional treatment or constitutional prescription. On the basis of the totality, either we have to consider the mental and physical reaction, which is to be individual to the patient, and healthy state which has been deteriorated in a given case. And once we talk the health in terms of the WHO, it's a health is a state of the mental, physical, and social well-being, and merely an absence of disease. And we have to give the constitutional treatment in order to give the permanent cure in a given case for the bronchial asthma by homeopathy. When patient is coming with the acute exacerbation of the symptoms, we have to just give the acute remedy. Once patient is responded with your treatment, then switch on to the constitutional remedy, which is indicated to the given case. And homeopathy, acute exacerbation of the symptoms, in terms of the study of the Ipecacuanha, which is carried out and the pilot study has been taken. And the study which has been taken in the, we have collected the cases from the arranging the camps and campaign in the rural areas as well as the urban areas of the Rajkot city itself. The definition itself is the patient is presenting with the wheezing, dyspnea, and cough. These are the three main triad of the symptoms of the presentation of the bronchial asthma. And the prevalence rate, that is the epidemiology, in which how many cases which is reported by the individual or any city or any areas affected in particular areas having similar signs and symptoms. We have to give sometimes majority is involved and having the more cases which gets reported. We can think of the epidemic disease, but the asthma or bronchial asthma, we have to consider the pilot study. By pilot study, we can think of the prevalence rate, the asthma cases which increase in between the periods of the 1980 to 1995. And I have taken the consideration into the 15 to 45 years of age group, and rest, that is male are vulnerable as compared to female. I will shown in my study. Epidemiology, that is the more than 15 years of age group and less than 45 years of age group. It is to be considered in my inclusion criteria. And regarding the socio-economical status of the epidemiology or prevalence rate of the bronchial asthma, the majority of the patients who are suffering from allergic response or allergic asthma, which is very common, which is also known as extrinsic asthma, that is early onset asthma or atopic asthma. We have to start with the common organ which gets involved in the asthma, that is lung. And the lung is having right and left lung. And right lung is having three lobes, as you know, upper lobe, middle lobe, and lower lobe. And left lung is having the upper and lower lobe. And we must consider the right lung is having the 450 grams of weight, and left lung, that is on an average 400 grams of weight. That is the picture of the lung, and right lung, it is directly connected with the main bronchus. And as you know, the tracheobronchial tree, because of the once the exposed to the allergens, which is secreted by the mucus secretory gland, and mucus get plugged in the bronchi itself. And the left lung is having the, as I talk, it is having the two lobes, upper lobe and lower lobe. And the pleural sac, the majority of the patient is having the involvement of the pleural. Sometimes patient is having the complication of the asthma leading to the pleurisy or pleural effusion, we can think of. And once we know the anatomy of the lung, we can able to know the prognosis and diagnosis of the disease. This is the picture of the left lung and right lung. And it is directly communicated with the pulmonary artery, that is main bronchus, and pulmonary vein, and the fissure, that is pulmonary ligament. It gets separated. Right lung is having the upper, middle, and lower lobe, and left lung is having the upper and lower lobe, respectively. The arterial supply of the lung, it is having the two sets of the artery which is provided to the lung. The first is bronchial artery, and second is pulmonary artery. And the bronchial artery, we can think of the artery which provides the directly communication to the right lung and originates from the posterior intercostal artery. And pulmonary artery that is located in the inferior to the arch of aorta. So whenever there is pulmonary artery which gets split into the lobar branches of the hilum and afterwards it gets split to the terminal bronchioles. So sometimes patient is having the alveoli or alveolar sac which gets involved and patient is leading to the emphysema. That is the types of the COPD, chronic obstructive pulmonary disease. So patient is having any allergic response, allergic asthma or bronchial chronic bronchitis along with the chronic persistent asthma and emphysema. The segmental effect of the pulmonary artery which gets involved the alveoli and alveolar sac gets involved and patient is complaining of the expansion of the chest which gets not possible in a given case. The physiology of the lungs. The main function of the lung is to supply the adequate amount of the oxygen. And as you know, we inspire the oxygen and we expire the carbon dioxide. And so the proper exchange of the gases which can take place in the alveoli of the lung, that is in tissue level and that is in lung level itself. So whenever air enters in the body through the nose or through the ciliated epithelium of the nose of the nasopharynx, the air gets traveled into the windpipe, that is trachea, and bronchi gets terminated into or terminal bronchioles, that is the smallest airways are microscopic in size, and sake of the bronchial sac which can leading to the alveoli, and alveolar sac itself, that is the balloon like collection of the air in the adult lung, and the physiology itself, the during inspiration, the expansion of the chest takes place. During expiration, there is a relaxation of the lungs. So we can able to expand and relax the our chest wall. That is because of the our movement of the chest wall. That is because of the our physiological action of the lung itself. The pathophysiology, as I talk, the normal bronchial tube, that is the it contains the relaxed the smooth muscles, and sometimes whenever patient is in response to the allergens, inflammatory process takes place, and that inflammatory process can tighten the smooth muscles, and sometimes the swelling or mucous secretory gland, which can or mucus get trapped in the bronchi, and patient is having the dyspnea, cough, and wheezing. That is the pathophysiology of the bronchial asthma. That is the effect of the asthmatic attack. Sometimes patient is having attack which remains continuous. That is the right and left lung, and alveoli, or that is the air sac or air pockets. The alveoli of the lung which has been nicely communicated with the disorders, that is emphysema, chronic persistent asthma, and chronic bronchitis, and it's the type of the COPD. And the smooth muscles, that is the lumen of the mucous lining or mucous secretory gland, and the contracted smooth muscles. Sometimes it can leading to the inflammation and swelling of the lumen itself and produce the excessive mucus. That is the anatomy of the asthmatic spell or asthmatic attacks, which is also known as status asthmaticus. The acute attack of asthma, it is to be considered as an emergency. The classification of the asthma, it is having the three types. The first is extrinsic asthma, second is intrinsic asthma, and third is mixed type. The extrinsic asthma, it is nothing but it is known as the atopic individual, where there is a prominent hypersensitivity which is responsible. There must be some extrinsic antigenic substance or any allergy or dust, fumes, strong smell, dendrites. Sometimes patient is keeps on having the episodes of the asthma because of the any pollens or any sensitivity or any weather which can or any environmental things can lead to the atopic asthma, or which is because of the allergic, and it is the most commonest type, extrinsic asthma. Intrinsic asthma, which is also known as non-atopic, it is usually takes place in the adult life or later age group, and patient is having typical symptoms developing that is upper respiratory tract infection. Either patient is suffering from acute bronchitis, and sometimes patient is having the pharyngitis. Sometimes patient is either extensing or presentation with the or presenting with the extensing and intensing both. That is known as the mixed type, having the strong allergy components, and sometimes patient may be or corrected with the constitutional treatment as well. The causes of the bronchial asthma, as you know, the most of the disease of the respiratory disease is because of the chronic smoking. But the bronchial asthma is because of the allergens, that is pollens, dust, mites, and dendrites, that is pet and dander. And sometimes patient is having the associated infection, other associated respiratory infection. Either patient is having the pneumonia, patient is having the consolidation, tuberculosis, lung abscess, COPD. Sometimes patient is having the acute rhinitis, allergic rhinitis, and suffering from bronchial asthma. So whenever infection gets settles in the chest wall, and it can leading to the bronchial asthma. Next is sometimes patient is having the certain beverages, certain dry fruits can leading to the sensitivity or allergic response that will leading to the extensive asthma in a given case. Sometimes GORD, gastroesophageal reflux disease, in which patient is having the acute gastritis, and patient is having erosive gastritis. Sometimes we can go for the upper GI endoscopy. Patient is complaining of the epigastric pain, headache, and retrostomal burning pain leading to the bronchial asthma. So sometimes GI indication or GI complaint which can leading to the respiratory components. Next is signs and symptoms of the bronchial asthma. As I already talked, the three main presentation of the bronchial asthma. The first is dyspnea, that is breathlessness. Second is wheezing, and third is cough. So dyspnea, wheezing, and cough, along with the tightness of the chest, along with the shortness of the breath, and sometimes patient having the coughing. The description of the bronchial asthma in terms of my research study, that is very important to know the certain research scale in order to know the research perspective. The first is Lara Asthma Symptom Scale, that is known as LAS. The Lara Asthma Symptom Scale, we have ranging the total score from 8 to 39, and we have divided the 8 symptoms in terms of the cough, wheezing, shortness of breath, asthmatic spell, that is asthmatic attacks, chest pain. How many attacks? That is the average number of the attack. Awakened at night means patient is comfortable with the attack or not. And overall severity, that is intensity of the symptoms in terms of intensity of the disease for bronchial asthma. And so we have ranging from the 1 to 5 score for the Lara Asthma Symptom Scale, that is from 8 to 39. The asthma control test, that is second test and very confirmative test for the asthma, and that is the most confirmatory research scale. For the, we have divided into score, that is respectively, along with the activities, shortness of breath, symptoms, whether patient is using any allopathic or any non-homeopathic drugging or not, and control rate. In terms of the activity, and more the severity, patient is cannot able to done the cannot able to do the activity. So the severity of the disease, it depends upon the whether patient is having comfortable with that particular symptoms or not. Second is shortness of breath, that is dyspnea. Sometimes patient having no dyspnea at all, that is score 5. Along with the symptoms which is aggravated at night, sometimes patient is having complaining in morning, more than 4 per week, that is considered to be score 1 in asthma control test, not at all sometimes. And use of beta-2 antagonist, patient is having the effect of the certain remedy which can leading to the symptoms in a given case. And control rate, that is patient is controlled with the trial, that is score 1 along with the ranges of the different score. asthma control test, it was based in the maximum score of 5 and minimum score of 0. And so along with the symptoms, the total score, maximum score, that is 25. And the along with the integrated with the symptoms, the total minimum score, that is 0 itself. So sometimes we have considered the 0 to 15, 15 to 20, and 20 to 25. And ACT score in terms of the research perspective, that is health related quality of life. Sometimes ACT will only assess the clinical symptoms of asthma, and clinical symptoms are the symptom which is observed by the experienced homeopaths in their clinical practice. So it is not significant to the health related quality of life. It is significant to the that particular disease itself. So disease symptom never to be considered. We have to consider the keynote features, which is key to the individual. Homeopathy based on the plane of the individuality along with the disease plane. So disease plane is to be considered when in terms of the homeopathy, we have to consider the homeopathic approach. The asthma control test, that is the level of the different, we have to see the level of the severity along with the particular to the individual. Next is the clinical symptoms of the asthma and correlate with the healthy lifestyle of the patient. Whether patient is assessing with the proper lifestyle or not, whether patient is taking proper dietic and maintain the diet and regime in their routines, and avoid stress in their physical and mentally in their routine life or not. So we have to assess certain types of the questionnaires in the asthma control test. That is the asthma quality of life questionnaires, that is AQLQ. And as we talk the definition of the health itself, we have to correlate with the asthma quality of life questionnaires, the physical, emotional, social qualities, and occupational itself. And we have to divide the physical symptoms of the individual along with the emotional plane, along with the social qualities and occupational. And we have to correlate with the types of the mental disease of the Hahnemannian types of mental disease, psychosomatic, somatopsychic, and so it is very important to know the different questionnaires, what to ask if patient is having asthma. Suppose we have the cases with the pilot study, we have considered with the study design, and patient is coming with your treatment. So we have divided, I have divided the 32 items in 4 domains. The 12 question which is related to the asthma itself, 11 related to the patient specific item and activity, that is in terms of the routine activity, in terms of the patient, whether the patient is comfortable with the sitting posture, whether sometimes patient is having asthma in lying down posture. During lying down, it is very common that there is an elevation of the diaphragm takes place during lying down posture. That is because of one is elevation of diaphragm, second is suppression of respiratory center, and third is more blood to the heart. These 3 things which can leading to the asthma, which is very common during lying down posture. So patient is complaining of PND, paroxysmal nocturnal dyspnea, or dyspnea at night time. So we can think of these are the common mechanism for PND. We have to explain to the individual during questionnaires. So 11 question that is related to the specific item and activity of life. So next is 5 question related to emotional function. Patient is comfortable with the certain emotion. We have to take the consideration, will and emotion, grading of the mental symptom, with intellect and understanding, sleep and dreams. So grading of the mental symptoms correlate with the quality of the life of the questionnaires of the asthma. And so 5 question which is related to the emotional function, and 4 question which is related to the environment, external environment can leading to the certain complaint in a given case. So these are the questionnaires we have considering in a 32 items in 4 different domains. The laboratory investigation of the bronchial asthma, as you know, the X-ray chest is not at all evident base. Sometimes we can think of expansion of the lungs, that is pulmonary function test. We can use spirometry to estimate the narrowing of the patient bronchial tubes by checking how much air patient can exhale, patient can inspire, breathe out and breathe in capacity, vital capacity, peak expiratory flow volume of the given case. Patient is asked to exhale the air in a forceful manner. Sometimes patient is having associated infection. So we can think of the sputum examination. Certain types of the organisms, some patient is having the eosinophil count, which gets increasing. Or patient is having AEC, absolute eosinophil count, or which gets increased, or eosinophilia, sometimes because of allergic response. So we have to taken into the consideration in a given case. The differential diagnosis, the condition to be suspected, person who are suffering from bronchial asthma. The first is COPD, chronic obstructive pulmonary disease. The disease itself is in which the first type, that is chronic bronchitis, the cough more than 3 months in a year, which remains for the 2 years, which is known as chronic bronchitis. And patient presenting with chronic mucoid purulent sputum in case of chronic bronchitis. Next is emphysema. Emphysema, on X-ray chest, patient is having emphysematous bullae, and on presentation, patient is having dyspnea. Emphysema is nothing but it's a permanent dilatation of the calyces of the lungs, parenchymal lung, and there is a destruction of the alveolar septa. Third is asthma, chronic persistent asthma. These are the types of the COPD. Second is tropical eosinophilia. The eosinophil count or eosinophilia, because of the allergic response, and which is very commonly seen in the tropical area or tropics, which is known as the tropical eosinophilia. Sometimes patient is having the constrictive bronchiolitis, or patient is complaining of the bronchial secretion which gets increases because of the pulmonary infection, associated pulmonary infection. Sometimes patient is having the lung abscess, purulent parenchymal cells or purulent material in the lung parenchyma. And patient is presenting with, in lung abscess, patient is presenting with halitosis or offensive breath along with the clubbing finger clubbing. That is the signs and presentation of the lung abscess. Sometimes patient is having cryptogenic organizing pneumonia. The pneumonia, most of the pneumonia after COVID pandemic, pneumonia is because of the novel coronavirus, that is viral origin. Initially, we can think of the Klebsiella, Legionella, lobar pneumonia, that is pneumococcal. And these are the commonest organism, gram-negative bacilli, cocobacilli, and these are the commonest organism responsible for the bacterial pneumonia. The complication of the bronchial asthma, it is having the three major triggering organ. The first is respiratory, second is cardiac, and third is acid base, that is hypokalemia. Hypokalemia, respiratory complication, cardiac complication, and hypokalemia. Hypokalemia, in which patient is having the low potassium level, and we can think of the balance or acid-base balance in terms of the sodium potassium, along with associated hyponatremia. The sodium imbalance takes place. We have to supplement the fluid and electrolytes in a given case. The first complication, that is respiratory itself, the bronchiectasis. The bronchiectasis is nothing but it's a abnormal dilatation of the parenchymal cells without any destruction. The destruction takes place in emphysema, which is not there in case of the bronchiectasis. From cough itself, emphysema having the types, that is subcutaneous emphysema, mediastinal emphysema, spontaneous pneumothorax. Pneumothorax is nothing but there is a collection of air in pleural cavity. Whenever there is a pneumothorax, we can that is because of the trauma to the chest wall. The driver steering wheel impact against the driver chest. So we can think of either patient is complaining of closed pneumothorax, open pneumothorax, and tension pneumothorax. Closed pneumothorax means all the signs of the RHMC, that is reduced chest movement, hyperresonance breath sound, mediastinal shift to the opposite side, and Cohen test which is positive. In open pneumothorax, all the signs of the closed pneumothorax along with crackpot sound on percussion, amphoric breath sound, and voice and cough may be heard like metallic echo. In tension pneumothorax, all the signs of the closed pneumothorax along with DA, displacement of the trachea and increased pulse rate, tachycardia, and increased temperature. So these are the signs of the spontaneous pneumothorax. Next is cystic degeneration of the lung itself. Sometimes degeneration of the mucus secretory gland itself can produce the degeneration of the or advanced pathology going to take place in the local areas or localized area of the lung itself. And sometimes patients having complication of the bronchogenic carcinoma also. And CA lung, the majority of the CA lung is because of the associated pulmonary infection along with the chronic smoking. And CA lung is presenting with the hemoptysis, presence of the hemoptysis and clubbing of phlegm. These are the two main features of the CA lung or bronchogenic carcinoma. Spontaneous rib fracture. Sometimes the rib fracture can leading to the respiratory complication of the bronchial asthma. From the infection itself, the recurrent bronchitis or allergic bronchitis or any pneumonia means inflammation of the lung parenchyma that will leading to the consolidation in the chest wall, or sometimes patient is having the fever with rigors and pleuritic type of the chest pain. Along with the pneumonia, patient is having sometimes complaining of the severe localizing chest pain along with the consolidation, along with the pleural friction rub. Either patient is suffering from pleurisy or pleuritic. Second complication, that is cardiac complication. Whenever there is we cannot able to inspire air properly, patient is having hypoxia because of the stress induced, or either patient cannot able to breathe air properly. That will leading to the arrhythmias. And that arrhythmias, sometimes because of the bronchodilator therapy. Bronchial constriction takes place in the bronchial asthma. Once we give the bronchodilator or with the beta agonist and theophylline, aminophylline, theophylline, etiophylline. Sometimes patient is undergone with the cardiac complication itself. An acute myocardial infarction. Patient is complaining of severe acute asthma, asthmatic attacks. That is the myocardial infarction. It's the necrosis of the some portion of the myocardium. Imbalance between oxygen supply and oxygen demand of the cardiac muscles. In asthma, bronchial asthma also, there is the oxygenation of the air or cannot oxygenation of the blood cannot take place properly in bronchial asthma. Similar kind of the event will also gets present in case of the acute myocardial infarction. But sometimes we have to take in care of the predisposing factor of the acute myocardial infarction. That is in terms of the age, sex, occupation, and obesity, and along with the poor lipid profile and lifestyle and stress itself. Third complication, hypokalemia. As I talked earlier, hypokalemia means decreased potassium level. Due to high dose of the corticosteroid or beta agonist and respiratory alkalosis. The four things which is very important: respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis. So any oxygen saturation which gets decreased, resulting into hypoxia. Carbon dioxide which gets increased, which is known as hypercapnia. So CO2 in proper manner, CO2 in more than adequate amount, which is known as the CO2 narcosis. So CO2 and O2 is to be maintained by the tissue level and lung level itself. And patient is having undergone with the hypokalemia, that is the lower potassium level. These are the other complications: nausea and vomiting from theophylline. Person sometimes giving the myopathy, because of the multiple uh, involvement of the muscle itself, because of the anabolic steroid itself, prednisolone and decadurabolin. These are the responsible steroid leading to the myopathy. Sometimes patient is having the respiratory muscle weakness and resulting into the weaning from the ventilator itself. The treatment part of the allopathic, more modern science, that is antibiotics if patient is having the complication and associated infection in a given case. And sometimes patient is on long-term medication, either inhaler, that is inhale corticosteroid or inhaler. This medicine given through inhaler by the your uh, bronchodilatory, the allergic response is decreases and it just dilates the bronchi. So the episodes of the asthma or episodes of the dyspnea gets reduced. Second is leukotriene modifier, that is Montelukast. The secretion of the mucus which gets increases by the mucous secretory gland. By effect of the Montelukast remedy, the secretion of the mucous secretory gland, it gets decreased. So once patient is exposed to the allergen, in spite of that, patient is not complaining any complaint in a given case because of Montelukast itself. The long-acting beta antagonist, that is salmeterol, and salmeterol is having the effect on the tracheitis, and tracheitis, because of the inflammatory process, it reduces the inflammation and patient is having response with the asthmatic spells. The xanthine derivatives, that is theophylline, etiophyllene, and aminophylline. These are the bronchodilators. Now, the main approach of the bronchial asthma in terms of the homeopathy, that is homeopathic approach. And the homeopathic approach, the main three subjects that is very important. The first is repertory, second is materia medica, and third is organ. Unless until you are not knowing the patient, that is the case taking, case processing, that is very important for the organ point of view. Organon is nothing but it's a to know the principle and philosophy of homeopathy. In order to know the organon, we must understand the patient as a whole. The patient profile or processing, case processing. Unless and until you are not knowing how to take the case, the thing will be very difficult for any practitioner. So the knowledge of the organon is to be cultivated or is to be integrated in terms of the materia medica and repertory. The knowledge of materia medica, the materia medica is the collection of the pure pathogenetic property of the drug. We must understand the each and every materia medica, the pure pathogenetic property, that is Pura by Dr. our master Anim. So which kind of the symptom which is written under Ipecac is to be considered in a given case by the way of the questionnaire or last scale or asthma control test. And third is repertorial aspect. Repertory is not, it is a language rubric which is nicely arranged. It's a language of the repertory. And repertorial aspect, we have to consider Ipecacuanha in terms of the Allen's keynote. The 3 mark symptoms, that is bold, 2 marks, that is italics, 1 mark, that is Roman. So in terms of the Kent's repertory, in terms of the boric materia medica, in terms of the boric therapeutic index of the repertory. So different repertory, gentry in terms of the concordance repertory. We have to consider the different software of the repertorial aspect, Homeopath Classic or Radar and NAIR repertory. So to know the efficacy of the Ipecacuanha in cases of the bronchial asthma, these are the 3 main approach it is to be considered. Next is the Ipecac is to be given into the consideration and strategic plan to prescribe the Ipecac. We have started with the correlate the different aphorism of the organon of medicine. In aphorism number 18, the master monsters the internal chronic miasm. The chronic effect of the individual, the sura, the real fundamental cause, that produces the numerous disease and including the asthma and ulceration of the lung itself. So we have to understand each and every aphorism of the organon of medicine, and it must be correlated in terms of the materia medica with repertory respect. The homeopathic approach in aphorism number 178, it is nicely quoted. Will no doubt sometimes happen in this medicine selected in strict observance of the homeopathic law, which furnishes the similar artificial disease suited for the annihilation of the malady present, means local manifestation. And this is much more likely to happen when these few morbid symptoms are very striking, decided, uncommon and peculiar distinctive, which is characteristic to that particular individual, which characterize the remedy. So on basis of that, I have prescribed the Ipecac characteristic like pyrexia, weakness, restlessness, cough, breathlessness, tightness of chest, mucopurulent expectoration, relapses, cough relapses, and found it to be observance in terms of the bronchial asthma. The case taking process. Aphorism number 83 to 104, that is in aphorism in commentary form of the organon. It is very nicely explained the Samuel Hahnemann and mentioned the direction of the assessment of the case taking. And there are many similarity between the ills assessment, the practice of medicine provide the assessment and treatment of the modern medicine, and hierarchy must be maintained. Sometimes in 5th edition of the Organon of Medicine, it is mentioned in 1830 that this is known as the perfect edition of the Organon of Medicine, which was published before the death of Darwin. The Ipecacuanha in true sense. What is Ipecacuanha? The remedy itself produces or sources of the Ipecacuanha, that is preparing from the roots itself. At the active principle, that is cephalin, emetin, and psychotrin. And the knowledge of the doctrine of signature, the active principles or alkaloids of that Ipecac, it is to be considered during sources. And doctrine of signature means method of collecting curative property by physiochemical property its source, of its source, that is known as the doctrine of signature. So active principle, that is cephalin, emetin. Emetin means vomiting. So Ipecac is a wonderful remedy for vomiting. And psychotrin is the alkaloids or active principles of the Ipecac. When we talk the pathophysiology of the Ipecac itself, means doctrine of signature, the chief action is on the ramification of the pneumogastric nerve, that is the vagus nerve, and which producing the irritation in the chest and stomach. Whenever there is affection of the pneumogastric nerve, we can think of the antimetard. It produces the affection of the pneumogastric nerve is causing depression in circulation and respiration by producing the keynotes. When patient coughs, there is a large collection of mucus in trachea and bronchi. As much would be expectorated, but nothing comes up in terms of the tartar emetic, that is in antimetard. But in case of Ipecac, by ramification or affection on the pneumogastric nerve, it causes the depression in circulation and respiration and causes asthma. Dry, spasmodic, constricted, asthmatic spells. The ancient use, the traditional Ipecac that is used in the powder form, and to clear the toxic effect of the stomach, it is given. Either it produces the vomiting, that is emitting effect by emit, patient is vomitous after taking the seeds of the Ipecac, and induce the vomiting by clearing the stomach and throw the toxin, that is noxious stimuli, whatever may be the in GI tract, it can throw it up. The doctrine of signature, that is the appearance of the characteristic plant along with the substance, inval illnesses, that is nausea, and Ipecac, that is tightness of chest, dyspnea, cough, and wheezing itself. The root of Ipecac, for patient is having sometimes purging, which was accompanied or detoxification and removing of the unwanted substance from the body. And sometimes patient is having the root effect of the Ipecac, the root cause of the disease, the tracheitis, or patient is having the bronchial secretion which gets increased. So it reduces the effect of the bronchial secretion and corrected the asthmatic spells in a given. That is the ramification of the doctrine of signature of the Ipecac. Thus, I have quoted with the different authors, renowned author of the, in terms of the Ipecac. The boric, as you know, Ipecac is a wonderful remedy for the hemorrhage. As you know, Ipecac is a wonderful remedy for the persistent clean tongue with constant and continually nausea. For hemorrhage, the color of the blood is bright red, just like phosphorus. Phosphorus is a wonderful remedy for hemorrhagic diarrhea. Ipecac is also given for the hemorrhagic diarrhea. That is differentiating point between phosphorus and Ipecac. Ipecac and phosphorus both are having the active hemorrhage. Phosphorus is having empty organ sensor in the stomach. Ipecac is also having the same kind of the weak feeling in the stomach. But the problem is having Ipecac is more towards the sensitivity to the air, leading to dry, spasmodic, constricted asthmatic spells. That is known case of bronchial asthma, which covered with the help of the Ipecac. Well, phosphorus is having for the establishment of the degenerative process, advanced pathology, psoriasis. The respiratory indication in terms of the boric materia medica, the bubbling sensation in the Ipecac, suffocative cough, cough which is incessant or violent or constant cough, and every breath full of phlegm. According to J.H. Clark, the respiratory symptoms of the cough usually nocturnal and which is aggravated at night. We have to consider whether cough, whether it is dry one or with mucopurulent sputum or productive sputum. If patient is having dry cough, then we can think of spongia tosta, rumex, bryonia, sticta pulmonale, and rumex. These are the remedy for dry cough. Once the establishment of the productive sputum in a given case, we can think of pyrogen, silicea, arsenic, surinum, acute inflammatory stage, which can leading to infection or localized infection in a given case, localized chest wall involvement. We can think of ferrum phos, belladonna, acute remedy, which can leading to infection. And Ipecac. Ipecacuanha is a remedy for inhaling the sensitivity, inhaling the any allergens. We can think of Ipecac. It is written in J.H. The jar is having the wonderful contribution, and jar is given the sensation that is dry, shaking, spasmodic cough with obstruction to the breath or to the air, which is leading to suffocation spell or suffocating cough, according to jar. Allen's keynote. It's a wonderful melodies of the homeopathy, and H.C. Allen has nicely described the dyspnea, cough, wheezing, and anxiety about the pit of stomach. Sometimes patient is having whooping cough, bleeding from the nose, that is epistaxis. When there is epistaxis, we can think of the phosphorus, bryonia. Bryonia is having vicacious menstruation in place of the menses. Bryonia is a hot patient. But phosphorus is a chilly remedy. We can think of indigo, antim tart. We have already differentiated rattling of the chest. It relieves the death rattle, and bronchi during inspiration, as per Allen's keynote. Jeticant, dangerously nose which has been drawn, and patient is complaining of bronchitis. Ipecac is usually given for the infant friend and is commonly indicated in the bronchitis of infancy. or earlier bronchitis or bronchitis in earlier age, we can think of ipecacuanha according to JETIC. The study design of my research paper of the material and methodology, I have conducted the research in my Sainath Homeopathic Hospital attached to the Rajkot Homeopathic Medical College, Parul University. I have kept 50 cases and the 7 cases has been dropped out. So I have considered out of 50, 43 cases is to be investigated properly and is to be uh, taking into consideration, and we have to take the sample size of the cases. The sample size, that is ZX Z square into P 1 minus P upon E square, and the inclusion criteria which has been discussed, the age between the 15 to 45, and sex, that is male are more vulnerable as compared to female. I will show you in later on. And the inclusion criteria, that is below 15, above 45, as given we have as given by the master Hahnemann in classification of disease. The surgical disease includes injuries. Aphorism number 186, the treatment of such cases are related with the surgery is to be avoided in this case. And patient with malignant condition is to be excluded. The type of study, that is open label prospective study. On the basis of the case taking, the data is collected by case taking, analysis, evaluation, transformation of symptom into rubric, selection of repertory, hunting of rubric, and steps of or process of repertory. Once the data is to be recorded, the process as per the guideline given by the CCRH. And I have strictly followed the guideline given by the CCRH, and our institution is having MOU with CCRH. And so all the research perspective, we have carried out the research in our premises, and the research perspective, the PQRS symptoms, that is peculiar, queer, rarity, and strange. And in terms of the general symptoms to the particular, and which is particular to the individual to help the constitutional treatment. And Ipecac, that is to be dispensed for each case after referring homeopathic materia medica and according to availability and presentation of the symptoms itself. Measurement of susceptibility and selection of potency. If higher the susceptibility, higher the potency, and lower the susceptibility, lower the potency. Advanced pathology, advanced disease, terminal disease, we have to start with the lower potency. The assessment of effectiveness of Ipecac, the clinical assessment will be based on the disappearance of the relief of the symptoms. Effective evaluation and assessment of the disease depends upon the intensity of the symptoms, graded by every patient with their presentation. Response is divided into 4 criteria: significant improvement, improved, not improved, and a depth the treatment. Means 7 out of 50 cases, 7 patients left the treatment, which are not in continuation with the treatment on. So we have studied the 43 cases. This is the clinical assessment score of indication of the Ipecac or effectiveness of Ipecac in cases of the bronchial asthma in terms of cough, wheezing, dyspnea, and use of bronchodilators. Starting from the score, excessive means score 4, moderate 3, mild 2, occasional 1, absent 0. Along with the presentation of the symptom, we have divided the grading. The maximum score, 4 complaint, that is so 16 maximum score, and minimum score, that is must be 0. The result of the study, the observation of the 43 cases of the asthma or bronchial asthma, which is observed in the 50 newly cases of the asthma included in this study. By referring the pilot study, by referring the study design, we have collected the cases from arranging the, we have regularly conducted the camps. So wherever we can assess the, or we can get this cases in terms of the either dyspnea, either cough, we can taking into consideration for the study perspective. So all age group, both the sexes, male and female. According to presenting complaint, that is cough, wheezing, dyspnea, tightness of chest, pre and post asthma control test, I will show you the result of the study. The age group, that is 15 to 45, the majority of the cases of the ipecacuanha, which is more reported between 15 to 25 years of age group. And the less reported cases in between the age group of the 36 to 45. The incidence of the variation of the gender variation, that is male to female, in 43 cases, the male are vulnerable as compared to female for the asthmatic spell, either because of the allergic response, either because of the environmental, and sensitivity, which is more in case of the male. But study design, emotional plane, which is also pertaining to with female as well. So we have to consider considering the effect of the associated infection on the gender variation. On that particular things, we have decided 23 male are vulnerable as compared to 24. These are the symptoms: pyrexia, restlessness, cough, breathlessness, and weakness. So breathlessness, the number of cases, the breathlessness is the main presentation. Out of 43 patient is having the breathlessness. So all the symptoms or all the disease which is pertaining to the individual, patient is having the complaint of the breathlessness. Weakness, 30 cases. Cough, 40 cases. Restlessness, 35 cases. And pyrexia, 30. So after breathlessness, cough is the main presentation. After that, restlessness is the main presentation. So pyrexia and weakness, which remains same. These are the economical status, so socio-economical status in terms of the bronchial asthma. The middle age group or middle socio-economical status are more vulnerable for the bronchial asthma. And the cases out of 43, 32 cases reported. So means 74.42% means almost 75% reported for the middle socio-economical status for the bronchial asthma. These are the control trial, and out of 43 cases, that is the controlled, the 31 cases is controlled, 6 is having the status quo, and 6 is having worse after giving the remedies. The distribution of the 43 cases of the asthma according to result of the study, where the outcome of the case, the significant improvement, that is in 31 case. Sometimes patient is improved, there is no any symptoms given by the patient. Sometimes patient might be coming with some kind of the presentation in 19 patients. So patient is improved in terms of the presentation, in terms of the complaint, and improvement under 31 patients. So the intensity of the symptom which get decreased, we have to consider. So 31 patient out of 43, that is improvement with the help of the ipecacuanha. Status quo. Status quo is having the six case, that is 14%. And worse means after giving the medicine, the thing has been increasing and worsen the condition in 6 patients. The statistical analysis of the study of the Ipecacuanha, that is very important statistical tools. The research question for the to explore the efficacy of homeopathic medicine Ipecacuanha in cases of the bronchial asthma. The null hypothesis means there is no efficacy of homeopathic drug Ipecacuanha in cases of bronchial asthma. Null hypothesis equal to mu1 minus mu2 equal to 0, equal to not 0. The alternative hypothesis, there is some efficacy of the drug Ipecacuanha. That is alternative hypothesis, that is mu1 minus mu2 is not equal to 0. That is what? some efficacy. The statistical tool along with the pair test, that is T that is test, that is procedure is to perform, is to compare the mean score. I will show you the pre and post mean score of the bronchial asthma. The T equal to D upon root square S square upon N. The N is nothing but the number of the pairs or number of the differences. The mean difference, that is D, mu D, that is cumulative case. Mu means cumulative. Mean. D is the mean difference between the two samples, and T is the pair sample, and T test, that is N minus 1, that is degree of the freedom. We have to state with the mean difference. And the S square, that is variance of the D, or D, that is mean difference, that is mu D square minus mu D whole square upon N minus 1. Number of pairs minus 1. So I can show you the difference between before and after. After giving Epicac, the previously the mean score, that is T test, that is 9.6. After giving the Epicac, 16.7. The variance of the 17.8 after giving the Epicac, 67.6. The observation of 43 cases, that is in contact with the hypothesized mean difference, that is 0. T stage, that is -7. And T critical one tail, that is 1.68. And before and after, in comparison with the T test paired to sample for the mean. So previously, other treatment, Epicac supervenes the effect of the other medicine. The study is showing that Epicac is given for the bronchial asthma. The discussion is, core of the discussion of our presentation today is the bronchial asthma, which is very commonly seen in the predominant in the male, having the middle socio-economical status, having the contribution of the allergic response, and we have to take into consideration of the Lara asthma symptom scale LAS along with the asthma control test, and gender variation more vulnerable to the male, and the control study, the improvement of the Epicac. Out of 43 cases, the 31 patient gets improved. 6 having status quo, 6 having worsen condition. So Epicac is the remedy or is the drug for the bronchial asthma. This is the age variation which has been already discussed in the observational study, along with the gender variation, along with the presenting symptoms of the asthma, along with the weakness, dyspnea, cough, and restlessness. Socioeconomical status, that is in the present study, and maximum participant who have participated in the study design or who are having the complaint. Control trial, control status according to LAS, and asthma control test according to the intensity of the disease, along with the result of the study. That is present study, maximum patient which shows with improvement, that is 31 cases with improvement, 6 status score, 6 words. So we can think of statistically data, statistically analysis, along with research perspective, research score, that is Lara asthma symptom scale, asthma control test, along with symptoms of the Epicac, which is taken into consideration, and outcome of this study is efficacy of homeopathic system of medicine in bronchial asthma was established. Number 1. The utility of homeopathic medicine Ipecacuanha in cases of bronchial asthma, and also the sphere of action of the medicine is known. And the awareness about homeopathic system of medicine in the society. Our main objective to study design for any research perspective, the community or society must be aware with the homeopathic concept or homeopathic approach, the system of the homeopathy. So it facility or any community must know the orientation towards homeopathy. So awareness about homeopathic system of the medicine in society regarding the efficacy of the bronchial asthma spread to the expected potential outcome by giving the result with the Epica, with explanation, with research dynamic, with potentiality, with evidence base, Ipecacuanha is given. The case design, I have just some of the one case, the asthma control test, that is the questionnaires, which is given to the, and it is to be filled by the observer, the 5 different case questionnaires. That is the asthma control test assessment score, along with the very poorly controlled patient and well-controlled patient. And the patient is summoned by having the complaint of the tightness of the chest and cough which is dry. Along with the history, patient is having frequency has been increased since 6 months. And complaints, patient was asymptomatic before 6 months. Complaints since 2 days. Complaint of dry cough since 2 days. The associated complaint, that is drowsiness and debility, with cough, with sleepiness, and accompanied with the complaint. Father is having the history of the asthma and the peculiar, that is desire for apple, perspiration that is on face. Sometimes it favors the anti-tard, but looking to the consideration of the different totality, the speech voice loss, respiration difficult with nausea, nausea with respiration difficult, respiration wheezing, cough suffocative, cough whooping, cough violent, respiration difficult, cough with respiration impeded, obstructed with, or chest of contraction. So you can see Ipecac is the which covers the 9 rubric and total marks covered 30. So looking to the consideration, sometimes we can think of anti-tard. In a given case, the totality matches the Ipecac. So to know the totality, along with this selection of the potency, systemic examination with correlation of the homeopathy, and the selection of the potency depends upon the knowledge of the organon. Just selection of potency, justifiable repetition of dose is led done by our master honeyman in organon of medicine. And prescription is Epicac 30 TDS for 7 days only. The intensity of the symptoms on ACT score, you can see, and I have designed the master chart of the bronchial asthma or in terms of the Epicac. These are the 10 cases of the master charts, along with the common presenting complaint, that is weakness and dyspnea. Sometimes patient is having associated infection. Patient might be complaining of fever because of the associated infection. Sometimes patient is having pneumonia coming with asthmatic spell. These are the different symptomatology, different pre-score, post-score effect after asthma control test. And Epicac 200, sometimes Epicac was prescribing 30. If patient is having long-standing complaint, we can think of lower potency. In medium potency, if patient is having acute complaint, it is the safe potency, medium potency to start in a given. These are the different criteria, different complaint in terms of the asthma control test, pre and post score, in terms of the which are the family history is to be considered to evaluate the miasm. Because what happened in acute exacerbation of the symptoms in a given case, we can find out the fundamental cause. And how to find out fundamental cause? That is aphorism number 5. Physical constitution, immoral intellectual character, mode of living and habits, social domestic relation, by occupation. So these are the point is to be considered in order to give the miasmatic remedy. Fundamental cause are the miasmatic causes responsible for chronic disease. So once we identify or we recognize the miasm, give anti-miasmatic treatment. So sometimes in my study, I have prescribed the Epicac. So we have to correlate the miasmatic block in a given. These are the cases with the evidence base. These are the master chart in which 50 cases of the Epicac. And these are the dropout cases, 7 dropout cases for the my research study. These are the references bibliography as per the one poor method. Thank you. Thank you all of you. Thank you, madam. Hello.
Okay, sir. Yes, sir. Thank you so much, sir, for this wonderful session. So I would like to ask if any attendees have any questions. So one question we have, how shall we manage acute episode attack of chronic bronchial asthma? Is Epicac is helpful?
Hello, madam. What is the question, madam? Hello.
Yes, sir. Let me repeat.
Yeah.
Sir, am I audible to you?
Yes, you are audible right now, madam.
So one question is that how shall we manage acute episode attack of chronic bronchial asthma? Is Epicac is helpful?
Madam, I have already discussed if patient is having the any complaint and acute exacerbation of the chronic asthma, when in acute phase, we have to consider that particular symptom. If patient is the 3 main presentation of the asthma, that is cough, dyspnea and wheezing. As I talked earlier, if patient is having dry, sometimes patient is coming with the simple dry cough, having the exacerbation, acute exacerbation of the chronic person. And so we have to consider what sometimes if patient is having dry cough, it is written under Epicac, dry, spasmodic, constricted, asthmatic. Similar kind of the presentation, if patient is having coming with the productive sputum, means chances of the infection in a given case. But as a homeopath, we have to taking into consideration whether patient is having asthmatic spell, and once the acute exacerbation has been over, then we can switch on the constitutional treatment. But in my study, the replication, there is no any remission of the symptoms, and I have damn sure I am very much satisfied with the Epicac in cases of the bronchial asthma. So acute stage has been corrected with the help of the Epicac as well. Madam.
Okay, sir. Any other questions from the audience? I think, sir, that's all for today. And we really had the very wonderful session and very informative.
Thank you.
This session brings so much awareness about the bronchial asthma. Okay, sir. Please share your experience.
I am very much thankful to the Mr. Manish Jain for we are having 4 homeopathic college for providing a wonderful platform for our faculties and for upcoming homeopaths. We are running the PG as well as PhD in our institution, in 4 institutions. So I'm very much thankful to the B Jain and moderator Mansi madam. So thank you very much, madam. Thank you.
Okay, sir. Thank you so much.